So Cohort A in CARTITUDE-2 was specifically looking at patients with 1 to 3 prior lines of therapy and who were lenalidomide refractory. And so, again, this was a subset of the CARTITUDE-2 study. The primary endpoint was MRD negative rate at a 10 to the minus fifth sensitivity. 20 patients were enrolled initially, median of 2 prior lines of therapy, 40% triple class refractory, 60% refractory to DARA, and of course all refractory to lenalidomide, since that was the inclusion criteria. And the response rates really looked fantastic in this group. So 95% of patients responded, 90% of patients now with the CR with a median follow-up of 17 months. And the durability of response looks fairly promising as well, noting the relatively short follow-up. So at 12 months, at least 90% of patients were still in response. The 15-month estimated PFS is around 70%. And most of the responses are ongoing at this point. Safety also continues to look relatively good, similar to what's been seen with cilta-cel in more heavily pretreated patients, perhaps a little bit lower grade of less frequency, of high-grade cytopenias in this less heavily treated patient. So I think it looks promising. It's still a small number of patients, but this Cohort A provided the background to support the ongoing CARTITUDE-4 study, which is a randomized phase 3 trial in this same population of 1 to 3 prior lines, refractory, comparing cilta-cel to a standard of care triplet, a doctor's choice of either pomalidomide bortezomib dex or pomalidomide daratumumab dex, and that study's ongoing.